Hello and Namaste. My name is Yogesh Pant. I am Component Manager for Governance and Advocacy at Integrated Water Resources Management Program of Helvetas Nepal. I am going to share with you our experiences of working during the COVID-19 pandemic. As you can see in this map, Nepal is a landlocked country located between India and China. It has a population of around 30 million, with about two-thirds engaged in agriculture and livestock activities. A large number of people are migrant workers in different countries, and remittance is thus one major source of earning. COVID-19 cases in Nepal are rapidly increasing in the recent days, though the fatality rate is still quite low compared to many other countries. Water sector. Nepal has made good progress in the water sector in the last few years. The water supply coverage is around 88%, and the sanitation coverage in terms of access to toilets is almost 100%. The entire country was declared open defecation free in September 2019. Nevertheless, the actual functional coverage of both drinking water and sanitation services is quite low. Many of the drinking water supply projects and sanitation facilities are not functioning properly. Reaching the unreached population, that is the 12%, is really challenging as they are scattered and difficult to trace. The water sector in the country is fragmented. There are many government and non-governmental organizations involved in the sector, and they have different approaches and working modalities. The government is making efforts to harmonize the sector. Helvetas started supporting drinking water and sanitation initiatives in Nepal from 1976. The Integrated Water Resources Management Program evolved in the year 2000, and it is active in selected municipalities in 5 districts in Karnali and Sudur Paschim provinces. As seen in this slide, the Integrated Water Resources Management Program has 5 major components: drinking water, sanitation and hygiene, water governance and advocacy, small irrigation, and water source conservation. Similarly, it also works on gender and social inclusion, good governance, and climate change and disaster risk management as cross-cutting issues. System development and strengthening is one of the working approaches of this program. Rather than working in isolation on any single component, it works simultaneously on various interacting components that comprise the whole water service delivery system. Working during COVID-19, Nepal declared countrywide lockdown on 24th March 2020, just after the second person was tested COVID-19 positive. Though a good and timely measure to prevent the spread of the disease, it brought the entire country to a standstill. Integrated Water Resources Management Program also halted its normal work initially, but after just a couple of weeks, it started resuming its activities in the municipalities, focused mainly on COVID-19 response. It has now resumed its normal works such as construction of drinking water scheme, sanitation facilities, and support to water resources planning in many areas. COVID-19 response. Safe sanitation and hygiene practice is one important measure to prevent the spread of COVID-19. The program's main COVID-19 response activities are awareness and information. The program prepared and aired a radio program on COVID-19, providing practical information about the disease and ways to prevent it. It also prepared posters and disseminated them in the working municipalities. Hand washing facilities. The program supported the installation of pedal-powered hand washing stations in the local institutions such as municipalities, health posts, and government offices. The pedal-powered hand washing stations are very simple technology and are locally manufactured. They are operated by foot. Pressing the right pedal flows water through the tap, and pressing the left pedal squirts liquid soap. The program also supported hand washing buckets with taps at the household level. Protective and sanitation material. The program distributed soaps, sanitizers, masks, gloves, thermal guns, and PPE. The PPE was provided to the staff of the local organizations working in the front line, while other items were provided at household levels and in quarantine centers. The quarantine centers are overcrowded and they have very poor menstrual hygiene management facilities. The program therefore also provided sanitary pads to the women in the quarantine centers. The program mobilized all these activities through the local governments, rural and urban municipalities, and NGOs. It used distance support and supervision and virtual meeting for carrying out the works. Way forward, the new normal. COVID-19 will not disappear soon. We'll have to learn to live with it. Obviously, we'll have to adapt our working modality and approaches to the changed context. Based on our experiences, here are some recommendations for carrying out WAS initiatives in the future. COVID-19 WAS awareness campaigns. The WAS awareness campaigns should be redefined from the COVID-19 perspective to prepare people to cope with COVID-19 and to give the right information for triggering behavior change. Use radio, television, and various social media and door-to-door campaigns for the purpose. Protection measures. Proper protection measures such as social distancing, use of masks, gloves, hand washing with soaps, or use of sanitizer, etc. should be applied in the entire process of the program implementation. While carrying out all its activities, distance support and virtual means should be used as far as feasible. Working with the local organizations, the program was able to carry out its activities effectively because it worked with the existing local governments and NGOs with a presence in the municipalities. So, the coordination and collaboration with the local organizations should be further strengthened. Enhance local capacity. The capacity of the local organizations we work with needs to be enhanced to address the long-term impacts of COVID-19. The local governments should be supported to adapt their development intervention and plans to the changed context. The NGOs and the CBOs should be able to facilitate and mobilize the people in local development processes, keeping them protected and safe. Moreover, WAS technicians and skilled persons should be developed at local level. Now, many of the technicians and persons with special skills generally come from outside. Self-reliance is one important measure to cope with the COVID-19. Innovative technology, though simple and locally manufactured, the technology like pedal-powered hand washing stations stated above are very effective to cope with the COVID-19 pandemic. Rather than continuing with the conventional technology, the program should strive for applying similar innovative technology while constructing the WAS infrastructures. Market mechanism and supply chain. Easy availability of materials such as soaps, sanitizers, masks, disinfectants are a prerequisite for coping with COVID-19. These materials will be needed in large quantity. Now, various government and non-governmental agencies are providing these materials, but once they stop these materials, may be in short supply. The market mechanism and the supply chain should be established and strengthened, especially in the rural areas, to ensure ongoing supply. Moreover, production of materials like masks, liquid soaps, sanitizers, and disinfectants is not difficult. They can be produced locally. WAS entrepreneurship development and promotion of social enterprise at the local level can support strengthening the supply chain. Okay, this much for now. I look forward to seeing you on 29 July 2020 and hope to have good discussion on different aspects of my presentation. I'll be very much happy to answer your queries and provide more information about our works. Thank you, Agenda for Change, for providing this opportunity to share our works and experiences. Thank you.